Today I'm here to talk about ethical issues, and what better way to do that than picking an event that clearly challenges these morals. The event I have chosen is about Dr. Kevorkian and his case on physician-assisted suicide. Assisted suicide is illegal in most countries, but the basis of it is a terminally ill patient will come in contact with a physician who will assist them in taking their own lives in a more humane way so they no longer need to suffer. It is much like euthanasia for animals, however, the actual patient gets to make a choice on whether or not they want to go through with it. The case is about Dr. Kevorkian, an American medical pathologist. His career in pathology started in the 1950s. In his time of residency at the University of Michigan Hospital, he became fascinated with death. Kevorkian continued studying death, and once completing his residency and earning his title as a specialist in 1960, he went on to travel to different states and inform people of his findings and belief on the topic. This went on until 1970, and after that, Kevorkian found himself unemployed. However, in 1986, he was introduced to the Netherlands practice of assisted suicide by lethal injection. And this is what gave him the idea to conduct physician-assisted suicides in America. He continued on studying the topic and performed his first physician-assisted suicide on patient Jeanette Atkins, a middle-aged woman suffering from severe Alzheimer's, in 1990. News of the event got to the media, and by 1991, Dr. Kevorkian's medical license was suspended. He kept conducting assisted suicides, ignoring the laws, and it is said in total he conducted 130 physician-assisted suicides. Eventually, Michigan passed laws against assisted suicide in an attempt to stop him and imprison him. And on March 16, 1999, Kevorkian was convicted of second-degree murder and sentenced to 25 years in prison. However, on June 1st, 2007, he was released for good behavior, and after declaring he would no longer conduct any assisted suicides. With his few remaining years, Kevorkian traveled across the country spreading his knowledge and beliefs on the topic of assisted suicide, and on June 3rd, 2011, Kevorkian passed away. This topic is controversial due to the fact that ultimately it is murder and suicide. The topic severely challenges the human morals of utilitarianism, of virtue ethics, and the divine command theory. This event of a physician-assisted suicide is breaking laws, and usually physicians must take an oath to provide all means necessary to help their patients. The proposition of this event is the individual will die anyways due to their terminal illness, so it should be their choice on whether or not they choose to die in a more humane way and not suffer. Another point for this is the individual will no longer be a burden on their family, their friends, or even the healthcare system. They will not be taking up a bed in the hospital that could otherwise be used to treat another ill patient. The composition of this event is ultimately it is suicide, and the physicians are ultimately murderers. Most of the time, physician-assisted suicide is done without the knowledge of the family, so they never will get to say goodbye to their loved ones. For the people who are religious, they believe that this act of taking your own life is sinful, and therefore committing this heinous act, you will go to hell. Most people believe that we are supposed to die of natural causes and not have a choice on whether or not we want to end our lives earlier. I was introduced to the topic through a show called Mary Kills People. Although fictional, it follows the life of a doctor who conducted physician-assisted suicides of her terminally ill patients. So before studying Dr. Kevorkian's case, I was already familiar with the topic. The research I did not sway my opinion. I have always been a supporter of this topic. There has constantly been a debate on whether or not this should be something that should be offered, and I'm in agreement that this is something that should be considered and made legal. Years ago, the sick would either get better or they would die from their illnesses. There wasn't medication or treatment to cure them. It was natural selection. So I strongly believe that if an individual is suffering with a terminal illness, they should have the choice on whether or not they want to prolong the inevitable. How studying this topic of assisted suicide has impacted my role as a health administrative assistant is it has opened up my eyes to the ups and downs of the lives of people suffering with illnesses and made me realize that we need to treat everyone equal and with the same quality of life. As a health administrative assistant, I must ensure I'm treating everyone with the same amount of patience and respect, no matter their illness, their race, ethnicity, or sexual orientation. After all, people with terminal illnesses are not just a piece of paper with information on it. They're still people with feelings, and they need the same amount of care as everyone else.